As the years pass, it's common for loved ones to grow older and face various challenges that come with aging. Among the many changes that occur, some are subtle and easy to brush off as part of the natural course of growing older. These could range from simple signs of slowing down to a sudden shift in behavior that might be dismissed as temporary or inconsequential. However, beneath these seemingly benign changes lies a deeper story. Often, these small shifts are not merely signs of aging, but the body's quiet signals that life is nearing its final chapter. They are quiet warnings that, if understood and recognized, can allow families to prepare for the final stages of life in a way that respects dignity, enhances comfort, and fosters deeper connections during the last moments of life. Many people experience the challenge of recognizing these signs because they evolve gradually, without an obvious or dramatic onset. It's only later, sometimes far too late, when families realize that these subtle clues were far more significant than they initially seemed. It's in the small moments, a change in appetite, an increase in tiredness, or a slight shift in personality, where the story begins to unfold. To better understand the deeper meaning behind these changes, let's look into two key signs that often appear a year before a loved one's passing: significant weight loss and extreme fatigue and weakness. 1. Significant weight loss, a red flag for declining health. One of the most noticeable, yet often overlooked, early signs that someone may be nearing the end of their life is significant, unexplained weight loss. For many, weight loss in the elderly is thought to be a natural part of aging. They're just slowing down, we might tell ourselves, assuming that a decrease in appetite or eating habits is simply due to age. While some loss of appetite and weight can certainly accompany the aging process, unintentional weight loss, especially if it happens quickly or without a clear cause, should not be ignored. This kind of weight loss is different from the slow, controlled shedding of a few pounds that might come with lifestyle changes, a change in diet, or conscious decision-making. Instead, it creeps up on you, sometimes unnoticed at first, but gradually becomes impossible to ignore. It might start with small clues. Your loved one's belt suddenly needs an extra notch, their favorite sweater feels looser than usual, or you notice a change in their appearance, like a more prominent jawline where once there was fullness. These signs are often so subtle that they may be dismissed as just part of the process of aging. Yet over time, the weight loss becomes undeniable. And that's when the true implications begin to surface. Understanding the causes of unexplained weight loss. Unintentional weight loss, especially in the elderly, can be a sign that the body is struggling to process and absorb nutrients. As people age, their bodies naturally undergo several changes that can make digestion and nutrient absorption less efficient. The stomach's ability to produce acid declines, which in turn affects the body's ability to break down food. Similarly, the intestine's ability to absorb nutrients may slow down, and the liver's capacity to metabolize nutrients diminishes as well. When these physiological changes accelerate, they signal a more profound breakdown in the body's internal systems. One of the most alarming consequences of this process is muscle loss. Muscle mass, important for strength and stability, begins to waste away, a condition known as sarcopenia. While muscle loss is a typical part of aging, when it's linked to a terminal decline, the effects are even more profound. The body starts breaking down its own tissues in an attempt to meet its energy demands, leaving muscles thinner, limbs weaker, and overall energy levels depleted. This isn't just a cosmetic change, it's a functional one. A person who once carried groceries with ease might now struggle with even the lightest bags. Someone who could walk for miles might now find themselves winded after just a few steps. These changes not only make everyday tasks more difficult, but also increase the risk of falls and fractures. As muscles weaken and bones become more brittle, the likelihood of injury increases. How appetite changes contribute to weight loss. In the final stages of life, many elderly individuals experience a loss of appetite, which exacerbates the problem. The body's drive to eat diminishes as it slows down. The sensory experiences of eating, such as taste and smell, can become dulled, making meals less appealing. A warm slice of pie or a favorite dish no longer brings comfort. Instead, food becomes a chore, and even the most enthusiastic eaters can lose interest in eating altogether. This diminished appetite is more than just a change in taste or preference. It's a biological shift. As the body senses it is winding down, the brain's hunger signals weaken, and the body no longer requires the same amount of food to fuel its systems. Consequently, energy demands decrease, and the motivation to eat further declines. The result is a vicious cycle. Eating less leads to decreased energy, which causes further weakness, and this downward spiral accelerates over time. The impact of chronic illness and mental health. Underlying chronic health conditions often contribute to this rapid and significant weight loss. Diseases such as cancer, heart failure, chronic obstructive pulmonary disease, COPD, or kidney failure can contribute to this decline, often in ways that are subtle and go unnoticed until the condition has progressed. In cancer, for example, the body may enter a state known as cachexia, where not only does it struggle to utilize nutrients properly, but it begins to consume muscle and fat in an attempt to keep up with its energy needs. This condition is particularly difficult to reverse because the body's metabolism is no longer working efficiently. In cases of heart disease or lung disease, the body may lack the strength necessary to chew and swallow food properly, further contributing to weight loss. Meanwhile, kidney failure can lead to an imbalance of fluids and proteins, further depleting the body's reserves. Additionally, mental health conditions such as depression or dementia can also play a significant role in weight loss. A person suffering from depression might forget to eat, while someone with dementia may not even recognize the sensation of hunger or have the capacity to prepare a meal. What families can do to support their loved ones. Families often try to intervene in an attempt to reverse weight loss by coaxing their loved one to eat, offering their favorite foods, or introducing nutrient-dense snacks. While these efforts are motivated by love and care, they often miss the bigger picture. If weight loss continues despite additional calories, the issue isn't just a lack of food, it's the body's inability to process and use it. Instead of focusing on trying to force a loved one to eat large meals, a better approach is to provide small, soft, easy-to-digest foods. Examples include mashed potatoes, broth, or yogurt, all of which are gentle on the stomach and can provide comfort. Hydration is also crucial, so offering water, tea, or electrolyte drinks can help maintain hydration levels and support overall well-being. Rather than focusing on calories alone, the goal should shift to providing comfort. Quality of life, dignity, and emotional well-being should take precedence over trying to meet caloric targets. By offering smaller, more manageable meals and maintaining a compassionate approach, families can help their loved one navigate this challenging time with greater ease and comfort. 2. Extreme fatigue and weakness. The body's final signals. Alongside significant weight loss, another unmistakable sign that a loved one may be nearing the end of their life is extreme fatigue and weakness. This isn't the kind of tiredness you might experience after a busy day, but an overwhelming, bone-deep exhaustion that doesn't improve with rest. Even after sleeping for hours, a person may still wake up feeling drained, and even the simplest tasks can feel insurmountable. Imagine someone who once took pride in their ability to maintain their home, cook, or take long walks now struggling to get out of bed. Tasks that used to take little effort, like crossing the room or standing for a few minutes, might now leave them winded or breathless. This exhaustion becomes pervasive, affecting not just the body but the mind as well. Even speaking for long periods of time may leave them feeling faint or dizzy. How families can respond to extreme fatigue. For families, the sight of a loved one's increasing exhaustion can be heartbreaking. It's tempting to assume that a good nap will solve the problem, but the fatigue that comes with this phase of life is not something that can be alleviated by sleep. Instead, it's crucial to understand that the body's internal systems are simply slowing down, and no amount of rest will reverse this process. Families should focus on supporting their loved ones' comfort, ensuring that their physical needs are met while respecting their need for rest. Offering assistance with daily tasks, creating a calm and restful environment, and providing emotional support can help ease the burdens that come with this exhaustion. The focus should be on making the final stages of life as peaceful and dignified as possible, with an emphasis on comfort over trying to push for activity or energy that simply isn't there. The immune system's natural decline with age. The immune system is a sophisticated network of cells, tissues, and organs that work together to defend the body against harmful invaders such as bacteria, viruses, and other pathogens. It also helps repair damaged tissue, keeping our bodies in balance. However, as we age, this intricate system begins to lose some of its effectiveness. The decline in immune function, known as immunosenescence, refers to the gradual deterioration of the immune system that occurs with age. This leads to increased susceptibility to infections and a slower recovery process after injuries or illnesses. Immunosenescence is a multifactorial process that affects various components of the immune system. One of the most significant changes is a decrease in the production of new immune cells in the bone marrow and thymus gland. As the body ages, it becomes less efficient at generating new white blood cells, which are responsible for recognizing and fighting off infections. The function of these immune cells, particularly T cells, also diminishes over time. T cells are crucial for identifying and killing infected cells, and their reduced function can make the body more vulnerable to infections. In addition to a reduction in the production and function of immune cells, the aging immune system becomes less able to mount a rapid and effective response to infections. The body's inflammatory response, which is essential for fighting infections, may become dysregulated, leading to chronic low-grade inflammation. This chronic inflammation can contribute to various age-related diseases, including heart disease, diabetes, and cognitive decline, making the body even more fragile in the later stages of life. Respiratory infections. Pneumonia and the elderly, respiratory infections, particularly pneumonia, are among the most common and serious infections that affect the elderly. Pneumonia is an infection of the lungs that causes inflammation and fluid buildup, making it difficult for the body to get enough oxygen. In healthy individuals, the body can usually clear infections like pneumonia with the help of antibiotics or other medications. However, for the elderly, pneumonia can be particularly deadly. As the immune system weakens, the lungs become more vulnerable to infections. The natural defense mechanisms in the respiratory system, such as the production of mucus and the ability to clear debris from the airways, become less effective with age. Additionally, elderly individuals often have other health conditions, such as heart disease or diabetes, which make them more susceptible to infections and complications. Pneumonia, in these cases, may not only be harder to treat, but can also be the trigger for further decline, sometimes resulting in hospitalization or even death. For families and caregivers, recognizing the signs of pneumonia in an elderly loved one is crucial. Symptoms such as a persistent cough, difficulty breathing, chest pain, or a fever may indicate a respiratory infection. However, it's important to remember that some older adults may not display the typical signs of illness. They might not have a fever or might experience confusion or increased fatigue instead. This can make it more difficult to identify the problem early, potentially delaying treatment and increasing the risk of complications. Urinary tract infections, UTIs. Urinary tract infections are another common infection in the elderly, often more frequent and more challenging to treat. UTIs can cause pain, frequent urination, and fever, but elderly individuals may not always exhibit these classic symptoms. Instead, they may become confused, agitated, or lethargic, making it more difficult to spot the infection. This is particularly common in individuals with cognitive impairments, such as dementia, who may already have difficulty communicating their discomfort. UTIs in the elderly can lead to more severe complications, including kidney infections or sepsis, a life-threatening condition in which the body's response to infection causes widespread inflammation. The risk of sepsis increases as the immune system weakens, and a relatively minor infection can quickly spiral into a life-threatening condition. For caregivers, it's essential to monitor for subtle signs of infection and seek medical attention promptly to prevent further complications. Slow healing, a sign of the body's struggle. In addition to the increased frequency of infections, the elderly also experience slow healing, which is another critical indicator of their body's weakening systems. When an individual is injured, the body's healing process relies on a series of complex biological responses, including blood clotting, inflammation, tissue repair, and the immune system's ability to fight off infection. As the body ages, all of these processes become less efficient. The skin's ability to regenerate decreases with age, leading to slower healing times for even minor injuries. For instance, a small cut that would heal within days in a younger person may take weeks or even months for an elderly individual. This slow healing process not only causes discomfort, but also increases the risk of infections. As wounds remain open longer, they provide more opportunities for bacteria to enter the body, further complicating the healing process. In some cases, elderly individuals may also experience chronic wounds, such as pressure ulcers or diabetic foot ulcers, which can be particularly difficult to treat. These types of wounds are often exacerbated by limited mobility, poor circulation, or pre-existing health conditions, making the body's ability to heal even more compromised. Emotional and practical implications for caregivers. The increased frequency of infections and slow healing are not only physical challenges, but emotional and psychological ones for both the individual and their caregivers. For caregivers, witnessing the decline of a loved one can be emotionally overwhelming. It can feel as though every infection is a step closer to the inevitable, a reminder that the body is slowly shutting down. The frustration and helplessness that caregivers feel when their loved one's body refuses to heal can be exhausting, as can the constant vigilance required to manage their health. For the individual experiencing these changes, the loss of independence can be devastating. The inability to recover from minor illnesses or injuries that once posed no threat can lead to feelings of helplessness, anxiety, and depression. the individual may become increasingly dependent on others for care, losing the autonomy they once cherished. This can result in a loss of dignity, particularly if they are unable to perform tasks like bathing, dressing, or eating on their own. As infections and slow healing become more common, families and caregivers must adjust their approach to care. They must balance the desire to preserve their loved one's comfort and dignity with the need to monitor and manage their health more closely. This often requires a delicate balance of emotional support, physical care, and medical intervention. Chronic and slow healing wounds. As the body's healing mechanisms weaken, even the smallest of wounds can take much longer to heal. A scrape from shaving, a bump against furniture, or a patch of irritated skin might become a persistent concern, refusing to close or heal properly. This is particularly true for those who are less mobile, bedridden, or spend long hours seated. Pressure sores, also known as bed sores, become an ever-growing risk. These sores occur when the skin breaks down under sustained pressure, often in areas where the body comes into direct contact with a surface like a bed or chair. Without proper care, these wounds can become breeding grounds for dangerous infections that further compromise an already weakened body. Poor circulation is often the underlying cause of these issues. As blood moves more sluggishly through the body, tissues are deprived of the oxygen and nutrients they need to heal. This stagnation in blood flow causes the repair process to stall, resulting in wounds that either take much longer to heal or never fully resolve. What might have been a simple issue in younger years, resolving in a matter of days, can now be a prolonged struggle that requires constant attention and care. It's a reminder of the body's vulnerability and the silent toll that aging takes on its natural processes. The vicious cycle of infection. The presence of slow-healing wounds invites bacteria into the body. These infections, in turn, weaken the body even further. The immune system, already compromised by age, struggles to break the cycle of infection, leaving the body unable to recover as it once would. Infections at this stage don't always present with the typical warning signs. Unlike younger individuals who might experience fever, chills, or body aches as their immune system mounts a response, older adults often exhibit more subtle or deceptive symptoms. A fever may not be present at all, or if it is, it may not reach the high levels typically associated with infection. Instead, older adults might display increased lethargy, confusion, or a general sense of weakness that can be difficult to differentiate from the natural aging process. One of the most subtle yet significant signs of an infection is a sudden change in mental status. Seniors, for example, may become more confused than usual, exhibiting symptoms like mistaking day for night, forgetting where they are, or becoming disoriented. These mental shifts can be one of the first indicators that something is wrong, often before the physical symptoms of the infection, such as a cough or pain, become apparent. Transitioning from curing to caring for those caring for an elderly loved one, witnessing this gradual decline can evoke a mix of emotions: frustration, helplessness, and grief. The instinct is often to fight, to demand more tests, more treatments, or perhaps another hospital stay in the hopes of turning things around. However, there often comes a point where the focus of care shifts from curing to simply caring. At this stage, aggressive medical interventions may not bring the desired results and may only serve to prolong discomfort. Instead, simpler and more compassionate measures become essential. Keeping the patient hydrated, ensuring their skin stays clean and moisturized, and minimizing physical stress can significantly ease their burden while maintaining their dignity. This delicate transition is not always easy, as caregivers face the difficult reality of knowing that their loved one may not recover. But this stage is also an opportunity for deep compassion, to be present with them and offer comfort, even as the inevitable approaches. It calls for an acute awareness of the small changes in their condition, the ability to recognize when something is escalating, and the judgment to act swiftly without causing unnecessary distress. Breathing difficulties and comfort measures. Breathing difficulties may also be accompanied by fluid buildup in the lungs, which can cause further distress. This condition can manifest as a persistent cough, a wet or gurgling sound with each breath, or the sensation of tightness in the chest. It's often referred to as a death rattle, and while it might initially be mistaken for a cold or allergies, it is usually a sign that the lungs are struggling to function as they once did. The difficulty in breathing may also make lying flat unbearable, prompting the individual to prop themselves up with pillows, recline, or even sleep in a more upright position to ease their breathing. For caregivers, these changes can be deeply unsettling. The sight of a loved one struggling to breathe or feeling the coldness of their extremities can trigger feelings of helplessness and an urgent desire to intervene. But it's important to recognize that these changes are not emergencies to be fixed. Instead, they are part of the body's natural process of slowing down. Though they may be difficult to witness, these shifts signal that the body is conserving energy and preparing for the inevitable. Providing comfort and peace. While it may not be possible to reverse these changes, there are ways to provide comfort during this difficult time. Keeping the room cool and comfortable can help alleviate breathing difficulties. A humidifier may soothe dry airways, reducing the gurgling sounds of labored breathing. Offering small sips of water, if they can swallow safely, can help alleviate dryness in the mouth or throat. Medications to reduce fluid buildup or oxygen therapy may also be suggested to ease the burden on the lungs. Blankets can provide warmth to cold hands and feet, while a gentle touch, such as a soft stroke of the forehead, can offer reassurance when words are hard to find. The key at this stage is to create an environment that is calm, comforting, and familiar. Surrounding your loved one with warmth, gentle care, and compassion can help them feel secure and loved as they approach the end of their journey. In these final moments, it's important to remember that while you cannot stop the inevitable, you can offer a peaceful and dignified end. Providing comfort through small acts of kindness and maintaining a loving presence can make a profound difference in the quality of their experience. The journey may be winding down, but your love and care can make that final chapter as gentle as possible.